FowlPox. So the occurrence is worldwide. The etiology is the FowlPox virus is a part of the AV poxvirus genus. There are homologous and heterologous strains. For the epidemiology, it's important. It can affect chickens, turkeys, pheasants, and pigeons. Each have their own type of poxvirus. There can be cross-infection of the host. It's not species-specific. There is a long-lasting immunity, and it affects fowls of all ages. In chickens and turkeys, it's more common in the winter due to vitamin A hypovitaminosis and viral diseases. For the pathogenesis, it depends on the strain. For homologous strains, they're more serious. The initial infection can be through per os, inhalation, or skin lesions which are caused by blood-sucking insects or carrier birds. The primary replication happens at the site of entry, and this leads to viremia and then generalization in organs, mucosa, and skin. For the heterologous strains, there's a crossover in FowlPox and turkey, and there's only primary replication. For the clinical signs, there are 4 forms of FowlPox. The first type is the cutaneous dry form. It's a small wart-like lesion in featherless areas of the skin, so it's a localized lesion and has lower virulence. This is the heterologous strains. The second form is the diphtheric form. It affects chickens, turkeys, and pigeons. It can cause malignant mucous membranes. It can affect the nasal cavity and the oral mucous membranes, and it causes proliferative nodules. There are more severe respiratory symptoms, such as a nasal discharge and conjunctivitis, and the clinical signs are fever, anorexia, and lethargy as well. And the third form are the mixed form. It's both dry and wet. The diphtheric form is known as the wet form, and the cutaneous dry form is known as the dry form. And the mixed form is a bit of both. And the fourth form is the acute hemorrhagic form. It's the canary pox virus. It leads to rapid death and there's no clinical signs. It's atypical. For the diagnosis, the clinical signs raise suspicion. For the histopathology, look at the Bollinger cytoplasmic inclusion bodies. And for mammals, it's the Guarini. For birds, it's Bollinger. And for diagnosis, you can use PCR and virus isolation. For control, it's a notifiable disease. Follow the general epidemiology measures. If there's an outbreak, carry out stamping out, etc. The vaccine is an attenuated FowlPox virus. You give it at 3 months of age on the combs, wings, and neck. The vaccine is an attenuated falcon and pigeon virus.